today is about seeing as many commissioners as we can, because we want as many patients using the apps as possible. And the idea is that commissioners will come along, see Painsense, and actually understand that there are benefits to patients, but also benefits to the NHS and that wider cost to the NHS as well. The users obviously are our major focus really, which is all about giving them the tools to understand about their own pain, and actually really it's about getting better outcomes for them, and that's our end point inevitably, that patients actually get better results and actually feel better themselves.
I think the major benefits of it are that patients have got access to the tools that are on the app for them to use on a day-to-day basis. So, they can monitor the progress using the app. There's many different teaching tools on the app that they can use to engage with on a day-to-day basis.
A lot of the apps for healthcare are out there on people's phones, and they're just being used in a single instance. They're downloaded by the patient, but the difference between the Painsense app and those other apps is that this is integrated and the data is safe on the N3 network. So you can refer patients from your clinical systems and get their information back into clinical systems in a safe way, basically.
Painsense is all about the patient. It is purely focused about embracing self-care and supported self-care, getting that patient understanding that they can help themselves. And that's a big part of Pete Moore's work and the Pain Toolkit, and that's where predominantly Painsense has come from. And Painsense is all about giving those reminders, not having to carry a little book around with them, not having to go to a website. 85% of the population have got a smartphone. I'm sure everybody in this room's got one in the pocket. And having those alerts on there, having something to reference, being able to sit and plug your earphones in any time of the day is what we're feeling majority of our patients are actually recognising as a benefit for them.
I think the benefits to the GP is the app directly links back to the GPs so that they can get ongoing progress reports from using the app from both the clinician and from the patients.
It started with a gentleman called Pete Moore, who's an expert patient really, somebody who's known across the UK. He's a visionary in my opinion. He's somebody who has worked with the GP Francis Cole, but in himself he's said to himself, I want to help as many people as I can. Persistent pain's a big thing out there. He worked in regards to getting it as a long-term conditions with NHS England, because it is something that a huge number of people suffer with. The work that he's done is just absolutely phenomenal, and that's led to Painsense being sort of that digital version of the Pain Toolkit.
As I say, there's been a few thousand patients using the platform, and it's been really good for in healthcare as well.